Hi, this is Dr. Coucher. I will be discussing delegation and prioritization in healthcare. Um, you will also, during our clinical conferences this week, receive some information on how to delegate and how to prioritize in nursing for the safety of the patient. So our introduction, it's not a new concept, delegation. We know that healthcare is demanding and patients are entering our healthcare systems with a whole host of greater needs. Due to the complex needs of the patients, there is more and more complex care for these high acuity patients. The demand for nursing care that is adaptable to the patient needs has grown exponentially. Healthcare law compounds the growing problems. It requires nurses to learn how to collaborate and work effectively with other members of the healthcare team. The responsibility to provide safe and effective quality care increases the challenges for us RNs to delegate appropriately. So what you're going to find through this lecture is a lot of concepts about assigning, delegating, supervising, and prioritizing. And what you'll find on your exam questions is you're going to see probably a case scenario where you have a list of patients and your job is to assure that you prioritize correctly, that you assign correctly, that you delegate appropriately, and that you supervise that process. So in assigning, that's the process of transferring the authority, accountability, and responsibility of client care to another member of the healthcare team. Delegating is the process of transferring the authority and responsibility to another team member to complete a task while retaining that accountability. And then supervising is the process of directing, monitoring, and evaluating the performance of another member of the healthcare team. RNs, we're all responsible for supervision of the client care task delegated to any assistive personnel and licensed practical nurses. And you all are LPNs, so you understand the process that goes into your RN delegating to you appropriately. Assistive personnel, those unlicensed assistive personnel are specifically trained to function in any assisted role to licensed nurses and client care activities. Certified nursing assistants, these are just some names for the patient care techs, certified medical technicians, dialysis technicians, monitor technicians, and phlebotomists. I don't think I need to tell you what the role of the licensed practical nurse is, but you know that you've completed and successfully passed your NCLEX PN, and this is why you're all here now. It's because you've been working as PNs, and now you're wanting to move on to that RN role. Assigning is performed in a downward or a lateral manner with regard to members of the healthcare team. Assignment factors, you have client factors, condition of the client and level of care needed, the specific care needs, such as cardiac monitoring or mechanical ventilation, need for specific precautions, if you have an isolation patient or a fall risk or a seizure patient, and procedure requiring a significant time commitment. When talking about the healthcare team factors, you need to take into consideration the knowledge and experience and skill level of the team members, the amount of supervision that is necessary, the staffing mix ratio, the nurse to client ratio, and the familiarity of the staff member to the unit. Delegating and supervising. RNs may delegate to other RNs, LPN, and assisted personnel. LPNs may delegate to other LPNs and assisted personnel. RNs must be knowledgeable about the applicable state Nurse Practice Act and regulations regarding the use of LPNs and assisted personnel. You need to be looking at your Nurse Practice Act. You need to be knowing what it entails for the RN. RNs must delegate tasks so that they can complete higher level tasks that only our RNs can perform. This allows more efficient use of all members of the healthcare team. Nurses can only delegate tasks appropriate for the skill and education level of the healthcare provider who is receiving the assignment. RNs cannot delegate the nursing process, client education, or tasks that require clinical judgment to LPNs or assisted personnel. Supervision always occurs after delegation. So you need to make sure that when you're delegating tasks that they are appropriate for the skill and education level of any healthcare team member. Don't forget that. Because what ends up happening is if you are delegating out a task and you're doing it the wrong way, then you have poor patient outcomes, and poor patient outcomes come back to bite us. So we need to make sure that we have the patient's best interest in mind, that we are doing everything that we can legally, that we are supervising after that delegation. It's just, I know that everybody probably thinks, oh, this is all just common sense, but it isn't common sense, and it actually doesn't come easily either. We all think that, oh, I can delegate out, but it's really hard when you have a healthcare team member or you have a team underneath you to delegate those responsibilities. Because at first, when you become an RN, you do find that it's difficult. You find that, oh, I don't know if I can delegate this because I might hurt someone's feelings. But we have to make sure that we're doing so and we're doing so appropriately. There are 5 factors for determining if a client care activity should be delegated. Number 1 would be potential for harm to the patient. Is the client unstable? Is there a chance that something negative may happen to the client? And what about the complexity of the nursing activity? Is the individual legally able to perform the task? Does the individual have the skills that are absolutely needed and necessary? Number 3 would be extent of the problem solving and innovation that is required. Does it require a nursing assessment? Because if it does, we know that we cannot delegate this out. Will a judgment need to be made while performing this task? Number 4 will be predictability of the outcome. Is this a new or routine treatment? Will the completion of the task have a predictable outcome? And number 5 will be the extent of the client interaction. Is there a need to provide psychological support or education to the client? There are 5 rights to delegation. I do not know why this slide is messed up, but please forgive that. The right task is repetitive. It requires little supervision and is relatively non-invasive for the client. In the right task instance, you must decide the appropriate levels of the team members, if it's the LPN or assisted personnel, based on the standards of practice, legal and facility guidelines, as well as available resources. Right circumstance requires you, the RN, to assess the health status and complexity of the care required by that client. Match the complexity of care demands to the skill level of the healthcare team member, and consider the workload of that team member as well. For example, delegate to assisted personnel to measure vital signs of a client. In a wrong instance, you delegate to the assisted personnel to measure the vital signs of a client who is post-operative and received naloxone to reverse respiratory depression. With the right person, it's to whom? You assess and verify the competency of the healthcare team member. The task must be within the team member's scope of practice. The team member must have the necessary competency and training. Continually review the performance of the team member and determine the care competency. Assess that team member, their performance based on standards, and when necessary, take steps to remediate a failure to meet those standards. A right way to delegate would be to delegate to a PN to administer intraoral feedings to a client who has had a head injury. The wrong would be to delegate to an assisted personnel those feedings. Right direction and communication. Communicate orally or in writing. Data that needs to be collected, method and timeline for reporting, including when to report concerns and findings. Specific tasks to be performed, client-specific instructions and expected results, timelines and expectations for follow-up communication. So in the right way, we would delegate to an assisted personnel to assist Mr. Martin in room 312 with a shower before 9 o'clock. The wrong would be to delegate to an assisted personnel to assist Mr. Martin in room 312 with morning hygiene. Right supervision and evaluation. This is how to supervise and how to evaluate. The delegating nurse must provide the supervision, either directly or indirectly, provide clear directions and expectations of the task to be performed, monitor that performance, provide that feedback, intervene if necessary, evaluate the client, and determine if the client's outcomes were met. We also have to evaluate the client care task and identify needs for quality improvement activities or any additional resources. Examples of tasks that can be delegated to LPNs. Now, again, you guys are all in practice. You know that you probably have things delegated to you that may not follow within certain guidelines. And I want you to remember and put this out of your mind, okay? Because you're going to be tested according to what the Nurse Practice Act is. You're not going to be tested according to what your practice is. And in NCLEX, it's a black and white world. There are no gray areas. There's no what ifs and the LPN here can do this or the LPN here can do this in this facility. You need to remember what the LPN can do according to NCLEX, that black and white world. You monitor the client findings as input to an ongoing RN assessment. You can do physical care, intake and output, reinforcement of patient teaching. You can't do the patient teaching, but you can reinforce it. You can do trach care and suctioning, checking the NG tube for patency, administration of medications, and it usually excludes IV meds, and that depends on where you work. But I'm just saying in the NCLEX world, this is where we are. Administration of enteral feedings, insertion of a urinary catheter, and some wound care and dressing changes. Example of tasks that can be delegated to the assisted personnel. Activities of daily living, bathing, grooming, dressing, feeding, without swallow precautions. And how many do we know that that gets delegated that to the assisted personnel? You have somebody will inevitably delegate that feeding with a patient who has swallow precautions. Ambulating, toileting, positioning, bed making, specimen collection, intake and output, vital signs on stable clients. When delegating and supervising, follow-up always occurs after delegation. Was the task completed on time? Was the performance of the task at a satisfactory level? Were abnormal or unexpected findings documented and reported? Was assistance needed to complete the assigned task in a timely manner? And should the assignment be reevaluated and possibly changed? You should use nursing judgment and knowledge related to the scope of practice and delegate according to the skill level. Use your 5 rights of delegation. Don't forget those. Supervision occurs after delegation. A supervisor oversees a staff member's performance of delegated activities and determines if completion of the task is on schedule, performance was at a satisfactory level, unexpected findings were documented and reported, assistance is needed to complete the assigned task in a timely manner, and assignment should be reevaluated and possibly changed. The ANA in 2005, the RN has the duty to be accountable for personal actions related to the nursing process. The RN considers the knowledge and skills of any ancillary personnel to whom aspects of care are delegated. The decision to delegate or assign is based on the RN's judgment regarding the following. What is the condition of the patient? The competency level of the members of the nursing team? The amount of supervision that will be required of the RN if a task is delegated. The RN uses critical thinking and professional judgment when following the 5 rights of delegation delineated by the National Council of State Boards of Nursing. The RN recognizes that a relational aspect exists between delegation and communication. Communication needs to be culturally appropriate, and the individual receiving the communication should be treated with respect. The decision to delegate or assign is based on your RN judgment. Regarding the following, the chief nursing officers are responsible for creating systems to assess, monitor, verify, and communicate continuous competency requirements in areas related to delegation. RNs monitor organizational policies, procedures, and job descriptions to ensure that they are in compliance with the Nurse Practice Act and consulting with the State Board of Nursing as needed. Using the nursing process for appropriate delegation. You don't get away from the nursing process ever. Assessment. Assess each client's care needs. Set the patient care goals. Match skills of the person assigned with the task needing completed. In planning, think these things through to decide about the delegation and what is appropriate. Use prioritization during the delegation so that you know that you're doing appropriately. Implementation, assign the task to the appropriate person, and then follow up, the evaluation. Oversee the care and determine whether the client care needs have been met. The criteria for delegation, there are task-related concerns, abilities, know the knowledge and skill level, legal definitions, role expectations, and job description for each member of the healthcare team. Individuals within each of skill levels possess their own strengths and weaknesses. You need to know those. Regardless of the length of time individuals have been in a position, employees need orientation and training for new tasks. Requests for assistance or additional explanations should not be ignored, and the person should be praised for seeking guidance. Respect and appreciate those who help you provide total care for the patients. When I think about an individual's skill level, and I think about the length of time that the individual's been in a position, I think about if you have a client, and sometimes we have frequent flyers that come in to the hospital, and there's a group of nurses. They've been taking care of this person off and on for years. And then you have a new nurse, maybe off of orientation for 4 weeks, let's say. And so you decide that as a charge nurse, you're going to delegate, and this person is going to assume the responsibility of caring for this patient. Should you think about maybe looking at the skill level of this new RN? Because that's really important to note. If everybody's been used to caring for this client and they have complex care, you probably don't want to assign this patient to that RN, not without giving them backup. Maybe assigning them to work with their preceptor to care for this client. So this is why we look at abilities when we're delegating, and we think about, because if we assign this new RN to take care of this patient, then our patient outcomes may not be up to par. It may not be positive because they might make mistakes, especially with the complex client. So just be aware of that and think about those things. All right, so priorities. And we're still talking about task-related concerns. Setting priorities for the day should be based on what your client needs are, what the team needs are, and organizational and community demands. Client basic physiological needs come first. So we're looking at oxygen, medication, IV fluids, enteral feedings, etc. Identify those priorities and decide the needs to be met first. In helping organize the care and deciding which other team member can meet those client needs. Efficiency. In an efficient work environment, all members of the team know their jobs and responsibilities and work together like gears in a well-built clock. Current healthcare demands that we work efficiently and deliver cost-effective care. Incorrect delegation can decrease efficiency and will cost money. And money, it comes down to us and our pay and what we're going to get back. So you need to think about that. Make sure that you're delegating appropriately. And I know you're thinking, well, what? How's this going to cost money? Well, if you are delegating to the wrong person and they're unaware of what they need to be doing, and the time it's taking in which to do it, it's going to end up costing the unit money, especially if there's poor patient outcomes. If you delegate inappropriately and something happens where this client ends up needing to be in the hospital longer because of a misstep in our delegation and making sure that we didn't set a priority and we weren't efficient, then it's going to cost the unit money and it's going to cost the hospital money and it's going to come back to us. Appropriateness. Nothing can be more counterproductive than pulling a coronary care nurse to labor and delivery. Floating or pulling nurses should be appropriate to their skills and knowledge. And I think if y'all think about one of my, maybe it was management or leadership, I cannot remember which lecture I did that I mentioned, if you can learn everything that you possibly can from any unit that you can possibly learn from, then you can be floated and pulled wherever you need to versus being having time off because the census may be down. However, I can recall when I first started nursing and I'd moved from CVICU and I had gone into women's health and I worked women's health surgery. I loved women's health surgery. It was a great place to learn your med-surg skills, but also focus completely on women. And so we used to have to be pulled up to 10A, which was oncology. Well, those couldn't be two different worlds right there. And it was always a complaint amongst the nurses. Now, I didn't get pulled up there but one time, and it was immediately after I was done with orientation. And so I want you to, I think about that now, and I think about the RN, the charge nurse that decided that that was the appropriate thing to do. I was just off of orientation, and pulling me up, taking me and floating me up to 10A was probably not the most appropriate thing. I had never had any orientation up there. I didn't know what I was doing. I didn't know where I was going. I knew nothing. And so you need to think about the appropriateness of where you're sending your new nurses to. More criteria. Relationship and oriented concerns. We want to talk about fairness. The workload should be distributed evenly in terms if both physical requirements and the emotional investment in providing that health care. Nothing destroys a team faster than playing favorites. That is just not the coolest thing to do. You don't want to look at the board and say, oh, difficult patient, difficult patient, difficult patient. Don't like her, so I'm going to make sure that she gets all three of those difficult patients while my buddy over here gets all these easy patients. Or given a new nurse, and if you're the charge nurse, knowing that you're giving your nurse 6 discharges for the day, which means that she's going to have 6 discharges and she's going to end up having 6 admits. That's not being fair, and that's not being appropriate. And learning opportunities. This includes assignments that motivate, challenge, and create new learning opportunities for any new nurse. That would be for an RN, that could be for an LPN, and that could be for any assisted personnel. The health. Consider rotating staff through more stressful assignments. Address personal and family needs of the employees whenever possible. Compatibility. Learn from teams that work well together and intervene with the team members when there are disputes. I told y'all about, my manager and what she did to me and pulling me into the office and saying, tapping her papers and saying, well, we have a team member who doesn't want to work with you anymore. it just wasn't. I look back on it now, and there's many things that I look back on as I've progressed through my education and realized that the appropriateness of how these things were done was probably it was subpar. And maybe it was because she really didn't know how to manage that type of situation. Maybe she just didn't know that, maybe she just didn't feel comfortable pulling another team member in there so that it could be discussed. Um, if there's a conflict in that matter, I would want to know what's going on, because not everyone works together as a well-oiled machine. There were some people that I knew when I came onto the unit and I saw them, yes, it's going to be a great day. You know, I know that I've got a great team behind me and we are going to work so well together. Staff preferences. Preferences of individual team members cannot supersede criteria for delegating responsibilities. I mean, just because I might have preferred a certain group of people to work with did not mean that I did not need to delegate responsibly, and did not mean that I did not need to uh, still work and try to be as compatible as possible. Barriers to delegation, experience issues. Nurse graduates from 1970s and 1990s practiced primary care, where there were fewer delegation responsibilities. Client acuity and care were less complex. Delegation can be intimidating, an intimidating responsibility. And then there are licensure issues, fears of unsafe delegation and loss of license. The courts have usually ruled that nurses are not liable for the negligence of other individuals, provided that the nurse delegated appropriately. Quality of care issues. Nurses have concerns about the quality of care they delegate. When these activities are missed, either delayed or omitted, um, the probability of untoward and costly outcomes does increase. So when you delegate, you control the delegation and the outcome. Assigning work to others, some nurses think they must do everything themselves, and some nurses will trust subordinates or distrust them. Some RNs are more comfortable with the technical aspects of patient care than the complex issues of delegating and supervising others. Patient teaching and discharge planning. You also have to consider the age differences between the RNs and the other team members, because more and more we have the millennials, and some of you in the classroom are millennials, but you're coming into practice as such. And I can remember, and I think about when I first started nursing, we had just moved to doing our assessments on the computer. And so there were several nurses that I got to know. And when we went live with, then I think it was Lawson or something along those lines, is not what it is now, Epic. But the same concept did happen when Epic went live, that a lot of older nurses retired because they did not want to learn the new systems. They just were not comfortable with them. They got comfortable with charting by handwritten notes, and then once we moved to the computer, it was a huge, huge weight on them. So you have to also, and that's why you have to consider age differences between the group members, because an older nurse is probably not going to mesh very well with some of the younger ones. But we have to make sure that we get rid of these barriers in delegation. We get rid of these barriers so that each group, each team can work together no matter the age. Prioritization, defined as deciding which needs or problems require immediate action and which ones could be delayed until a later time because they are non-urgent. Excuse me. Prioritizing requires making a decision regarding the importance of choosing a specific action or activity from several options. There are 3 levels of priority setting. There's ABCs plus the vital signs. These are the most critical. Address the mental status, pain, untreated medical issues, and any abnormal lab results. Consider the long-term health or chronic problems, health education, and coping. One of the most difficult tasks for new nurses to master is prioritization. I say develop a personalized worksheet. It is, to me, it is a time saver. I will tell you, I remember when my daughter first graduated nursing school, and I'm sorry, I give y'all stories, but it kind of puts some things in perspective. And she was going through her orientation process. And while she was going through her orientation process, every single day that she would leave work, I would get a telephone call. And she's not a crier. She does not like to cry. And there were so many days that, she called me crying, just feeling like that she was overwhelmed. I can't do this. I get behind. This happens, that happens. And so I sat down one night, and this was after, hearing these conversations over and over again, and decided that I needed to stop being a mom and I needed to start being a mentor. And so what I did was I developed a personalized worksheet for her, and I printed it out and I took it to her and I said, here, use these. Now you can put your meds here, the times that they're due. And I said, I don't work the unit that you work, but I'm trying to help you and I'm trying to mentor you to help you so that you can prioritize your day, you can prioritize your time, you can prioritize your patient care. And so she took that personalized worksheet and she developed it even further so that it fit her needs and the patient needs on the unit that she was working on. So I highly encourage you to do that when you're prioritizing. When you're going into a patient's room, trying to remember, okay, when I assess this patient, which one? I heard crackles. I got to remember this. I got to remember this. If you have a personalized worksheet, you can write this down. 212, crackles, right side. You just abbreviate, write things, and remember them so that when you sit down to chart, it brings it back for you. Time management, it is sometimes difficult. Time initially spent developing a plan will save time later and help to avoid management of crisis. You want to set goals and plan care based on established priorities and thoughtful utilization of resources. Complete one client care task before beginning the next, starting with the highest priority task. Reprioritize, and can you see this looking like the nursing process? Reprioritize remaining tasks based on continual assessment of your client care needs. At the end of the day, perform a time analysis and determine if time was used wisely. Time management and teamwork. Be cognizant of assistance needed by other healthcare team members. Offer to help when there's unexpected crises that occur. Assist other team members with provision of care when experiencing a period of downtime. Time management it's teamwork. Sometimes it has to be. You don't want to let your team member drown. So just think about that time management and prioritizing the needs of not only your clients, but of your team members as well. Tips for organizing work on personalized worksheets. Again, I told you about my daughter and what we did. Plan your time around activities that need to be done at a specific time. Do high priority activities first. Stack your care. That's a real big one right there. When I did my DMP project, that was one thing that I talked about to the preceptors about stacking their care. And going in and doing as much as you can in that patient's room at one time. Remember that you're responsible for activities delegated to others. Consider your peak energy time when scheduling optional activities. I know that sounds kind of funny, but when you work nights, which I did for many, many years, my peak energy time was not 3 o'clock in the morning. Because by 3 o'clock in the morning, I had already had my midnight breakfast, and so I was done. It was over. I could not consider doing anything else. Here's just a sample worksheet that I can have put together for my daughter, and you can use something like this. You can use something like this for yourself, even in clinical, because you're going to have more than one patient. And so with more than one patient, you want to write down, what did you assess, and go from head to toe. You want to look at your meds, you want to look at your orders, you want to look at the patient needs. Models of care delivery. We have to talk about the models of care delivery. This is because you're going to see so many different ones. Functional nursing, team nursing, total client care, and primary nursing are models of care delivery that were developed in an attempt to balance the needs of the client with the availability and skills of nurses. Regardless of the care model, the majority of nursing care is delivered within a group practice model where coordination and continuity of care depend on sharing common practice values and establishing communication. To me, nursing is an absolute team sport. I love the team aspect of nursing. When we are in clinical together, I love the team aspect of, yes, I am your supervisor when I'm there. I am your faculty member, but I love working as a team. And I love being able to communicate with y'all differently in the clinical setting and showing y'all what teamwork is and being a part of that. I usually have a really good group of nurses that I work with who also are great with teamwork. Nurses need to develop strong delegation and strong communication skills to successfully follow through any given model of care delivery. Team nursing, one of my favorites, grew out of functional nursing. Nursing units often resort to this model when appropriate staffing is unavailable. A group of nursing personnel or a team provides care for a cluster of patients. The RN assumes the role of the team leader. The teams usually consisted of an RN, LPN, and assisted personnel. The team leader directs and supervises the team. The team leader acted as a liaison between patients and the physicians. RN responsibilities included nursing care plan development, just transcribing orders and communicating orders to other team members, and also solving problems. The team leader had to be strong in communication and a strong delegator. I just personally love team nursing. I think it was one of the best models of care delivery, but we are moving away from that. There's not many units that actually use team nursing anymore. Total patient care is probably what you're going to see nowadays. The original model of nursing care delivery from the 1920s. Most nursing was in the form of a private duty nursing in homes or hospitals. Student nurses staffed hospital units while in school. The RN assumed care of one patient and performed all care. In the homes, the nurse was also responsible for cooking meals and doing laundry. Now, no, you're not going to be doing total patient care and cooking meals and doing laundry. However, we know that the type of patient care that we are doing is along those lines, which is on the next slide. Primary nursing. During the 1960s, nursing care delivery models started moving away from a team approach and placed the RN in the role of direct patient care. You see so many trends in nursing. We see this constantly. It is always moving. It is always changing. And so much of what we see nowadays is primary nursing. And in primary nursing, you are going to receive a group of patients. You're going to have 5 or 6 patients, and you're going to be taking total care of them. You might have, depending on the unit that you work on, there's only a couple of units in the hospital at Baptist that actually staff LPNs. I know that BHEC does, which is long-term care, and I think that 7A, it might be, does, um, but not very many staff LPNs anymore. We transitioned LPNs out of, for instance, women's health. We always had team nursing, RN, LPN, nursing assistant. And now you have primary nursing where the RN cares for not only the mom, but she cares for the baby as well. So 3 moms, 3 babies, 6 assessments, and you might have a patient care tech that day to assist with other things. But this is where we are moving to once again in our care delivery of the patient. So in conclusion, delegation is an essential component of nursing. Just as we had prereqs for school, meaning each class really builds on the next, delegation requires that the nurse to understand the prerequisite of prioritization and organization so that you can delegate appropriately. Nurses must also utilize those leadership and management skills and understand each staff member's ability. Thank you for listening to this lecture. Sorry that I was not in the classroom yesterday. I was just very ill. But you have my PowerPoint to look over along with your YouTube video for this.